Welcome to the Wellbeing at Work video series. I'm Kylie Cox, the Healthy Worker Advisor at Business SA and the facilitator for the Wellbeing at Work video series. This series of videos has been developed to guide your business in how to integrate physical and mental wellbeing into business as usual and begin to reap the rewards of a healthier workforce. As a reminder, this slide shows the overview of the 5 sessions. In session 1, we looked at the business case and analysed the justification for health and wellbeing at work. In session 2, we looked at the key elements for success and sustainable health and wellbeing. And you're now watching session 3, which is all about the various frameworks that are useful for workplace wellbeing and an explanation of the step-by-step process to develop a wellbeing program used by SA Healthy Workers Toolkit. We mentioned in session 2 how important it is to plan. It is one of the key elements outlined in the critical phases to health and wellbeing. Well, this session will take that step a little further and break it down into some more detailed planning on a health and wellbeing program. Importantly, with this session though, it's critical for you to consider the key elements of no one size fits all, because with the following frameworks that I present to you now, you should consider these in the context of your business and what will work for you. What I'm going to talk about in this session is project and change management frameworks, the Total Worker Health Framework model by the Centre of Communicable Disease in the United States, the Mentally Healthy Workplace Framework by Return to Work SA, the Thriving Workplace Framework by Superfriend, and the Healthy Workers Healthy Future model by SA Health. Firstly, all workplace health and wellbeing planning process should follow a similar outline to project management and take into the account the principles of change management. From a project management perspective, the key components are as follows. You need to initiate the project, which usually begins with a business case. The second phase is to develop the roadmap, which everyone can follow, including the activities, responsibilities and budget. The third is to launch and execute, which feels like the meat of a project where everything is happening. And fourthly is to measure the performance and monitor deliverables. And on top of these project management phases, we then also need to add in those elements of change management. And that includes ensuring the business case is presented to the entire business and not just to senior managers to get everybody on board, to allocate enough resources for the change to occur, to consult with staff, which will improve and uptake the program, to review and remove any barriers, and to look at what short-term wins to get some momentum happening and to get some buy-in. And as with Cotter's change model, you will need to enlist a volunteer army to help with the health and wellbeing program. So at the end of the day, it doesn't matter what framework you use, you just need to use change management principles and also the components of project management. And then your health and wellbeing program will be meaningful to staff, they will be engaged, and you'll be able to demonstrate your achievements in the long run. So I'm now going to talk about a few of the different frameworks that can help you action plan, with the first one being the Total Worker Health model. The Total Worker Health model is being used more often, becoming more popular due to the integration of health, safety and wellbeing. Much of the materials for this model link to the National Institute for Occupational Safety and Health called NIOSH. They're from the Centers of Disease Control in the United States. It's defined as policies, programs and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts to advance worker wellbeing. So here's an example of the Total Worker Health model. It fits nicely into the hierarchy of control. Just say one of your health and wellbeing strategies was to have a program to target reductions in musculoskeletal disorders. With the Total Worker Health model, it will consist of the following: reorganising or redesigning the work performed by staff to minimise repetitive movements and awkward postures, providing ergonomic consultations to workers to improve job and workstation design, providing ergonomic training and opportunities for workers to participate in design efforts. The last section would add in prevention. You would evaluate the age profile and health needs of the workforce to provide education on self-management strategies, including preventative exercise for arthritis or other musculoskeletal conditions. I'll include a link to the Total Worker Health Fundamentals Approaches Toolbook in the comment section below for you to refer to later. The next framework to help you action plan is the Thriving Workplaces Framework by Superfriend. SuperFriend began in 2007 when super funds and insurers came together to coordinate an approach to reduce suicide and improve the mental health of their members to enable them to enjoy long, positive and mentally healthy retirements. They have got great resources, and in particular, over the last 4 years, they've developed the SuperFriends Annual Workplace Mental Health Survey. The 2018 Indicators of a Thriving Workplace report surveyed more than 5,000 Australian workers across different industries, business sizes and work roles against these 40 scientifically validated characteristics that indicate whether a workplace is thriving. The SuperFriend model includes 5 essential domains: leadership, connectedness, policy, capability and culture, all of which are essential for creating positive and thriving workplaces. SuperFriend has developed guidelines to equip readers with the evidence, along with business case for building thriving workplaces and simple, cost-effective ideas to action. An example that we'll look at in the capability domain in this model is around good leadership. It's linked very strongly to individual wellbeing, with 40% of employees more likely to be in the highest category of job wellbeing and a 27% reduction in sick leave where they're effective leaders. So we've spoken about the importance of building skills and capability of leaders. It's a key effective strategy for workplace wellbeing, and in action planning, this could look like mental health awareness training, coaching, development of leadership style, effective communication and leading with compassion. The report and guidelines are an essential reading, and they're provided also in the comments below. The next framework that can help you action plan is the Mentally Healthy Workplaces framework. There are some good models around for mentally healthy workplaces, but the one that I think is simple yet comprehensive is used by Marty Webber, the mentally healthy consultant at Return to Work SA. This model includes 4 success indicators, including raising awareness, supporting individuals, so this is related to providing leaders and managers with appropriate skills to support staff who they're concerned about. It's about reducing risks and taking a preventative approach towards bullying and harassment, communication, managing stress and change, and then also providing effective return to work strategies. So for those people who have had to take time off, how best to get them back through recovery and make reasonable adjustments. I would recommend viewing the Return to Work website as another source of content when choosing the best planning tool. So the last framework to help you action plan is the Healthy Workers Framework. Each Australian state has a framework for workplace health and wellbeing with very similar phases. And here's a quick overview. Queensland has adopted the 5 steps to a healthier, happier workplace, which incorporates management commitment, wellness planning, needs assessment, action planning and evaluation. Western Australia's Healthier Workplaces Model framework is Plan, Do and Review. New South Wales Health has adopted a Get Healthy at Work model using a program cycle that reviews leadership commitment, involvement of workers, needs assessment, develop your plan, implementation, monitoring and review. Tasmania uses the same model as New South Wales, and today I'm going to take you through our SA Health, Healthy Workers, Healthy Futures model. The toolkit and resources are available on the SA Health website and are extremely useful for all businesses when choosing to use this framework. The model includes a step-by-step approach covering 4 stages: getting started, needs assessment, action, and monitoring and review. Step 1 is getting started, which incorporates gaining management commitment and beginning to get employees engaged and finding some workplace champions. We spoke about this in video 1, the justification for a healthy workplace. So if you've not visited that, then I suggest you do so now. Regardless of the business size, this step is critical to ensure that managers and leaders are on board and driving the program. And the earlier the better is when you're trying to get staff involved. You can do this by getting staff to volunteer to become involved in a workplace health and wellbeing committee. Step 2 is a needs assessment. You need to determine what interests your workers, what's already in place, what the main risk factors are, what the environment and the policy and practices are like. So a needs assessment includes multiple elements, and it's important to remember that not one size fits all. First of all, assess your biggest asset, your people. And how? Well, ask them. Here are a few suggestions. If you've got a small team, at a team meeting, ask them, what 3 things could we do here that could help us be happier and healthier? You could use an online survey platform like SurveyMonkey. You could put out an old-fashioned suggestion box or a new-aged email request. You could undertake health assessments and get overall feedback from the provider who takes those health assessments. There are also some good paid online versions of health and wellbeing and needs assessment, including the Deloitte Wellbeing at Work Index and the High Performing Workplace Index. And then you need to review any of your business data, injury data, near misses, absenteeism, usage of EAP, age profile, because all of this information will help you prioritise your business's health and wellbeing needs. We then need to assess the physical environment. So perform a work site audit using the Healthy Workplace Audit tool. It looks at the infrastructure, resources, the lighting, kitchen facilities, are there opportunities for active transport? Have a discussion if there's anything physically that the staff would like to have access to within the environment to make their day healthier. And lastly is to look at the vision and the culture and the policy. So this is included in the Workplace Audit tool. And it will look at all the policies that align, such as your code of conduct, bullying and harassment, smoking, drugs and alcohol, work-life balance, and to look at your staff culture. So you may already undertake some kind of staff culture survey, and this really looks about commitment to the business, to staff, happiness. We know that workplace wellness is integrated within HR and WHS. So if you have either of these functions at work, there will be information to form part of your needs assessment. As an example of this step, a small construction crew that I worked with consisted of an owner and 8 staff. At a lunchtime, we held a general discussion about what their main health concerns for themselves and what health concerns they had on site. We also then undertook a physical environment perspective and discussed what it makes it hard for them to be at work and to be healthy and what make it more beneficial. And the owner then considered the policies he had in place and how he was setting an example for his crew. Assessing these 3 areas provided this small business with some key priority areas, which ended up being sun safety, healthy eating, and ensuring that there was water on site all the time. Step 3 is action, which includes developing an action plan and then promoting the plan and implementing it. All the steps above are critical in the planning process. If you don't plan, your plan is more likely to fail. The action plan is a key component. Now that you have your needs assessment, what are you going to prioritise? What actions are you going to undertake? Who's going to perform them? When will they be done? How much money may be required or how much time? So this step includes answering every question and ensuring that the responses are put into the plan and then being able to have it endorsed by management. The other frameworks previously mentioned can provide some direction for you to create your action plan, as does the Healthy Workers Toolkit. With all the content available, there's plenty of information to get you on your way, whether it be an action plan on mental health, particular health hazards like sun exposure or musculoskeletal injury, lifestyle factors, smoking, nutrition, alcohol, physical activity, or general preventative health. As an example, I'm showing you now on the screen an action plan that was developed for a business with 20 workers, which was put up for approval to the CEO. As you can see, it includes the healthy people strategies of providing health information and a few activities such as yoga and the corporate cup. And then it included training for staff and mental health first aid and stress management. In the place or the physical environment audit, there was a lack of kitchen utensils, and staff provided feedback that they wanted some stevia and fruit. They were going to be doing yoga, so then they also requested to have yoga mats, and in Mad May they moved their bins out of the offices to encourage more movement. Lastly, in their policy and vision strategy, there was a review of the smoking policy, the flexible work policy, and a new workplace wellness statement was written by the CEO. At the monthly staff meeting, a standing agenda item was added at the end of the meeting, and any health and wellbeing issues were brought to the table. Step 4, monitor and review. The last step in the toolkit is to monitor and review. This step is linked with one of the key principles for success that were outlined in video 2. It's important to maintain good records as you would for any project in the workplace. If you write your action plan well, then it will already give you an indication of what you want to keep in terms of record keeping. The Healthy Workers, Healthy Futures Toolkit has some helpful templates for evaluation and monitoring. It will include demonstration participation rates, number of changes made to policy or the environment, and feedback from staff on the program. Overall, you can look at environmental audits, yearly absenteeism, work cover claims, staff satisfaction surveys. So there you have it, the step-by-step guide to developing a successful workplace program. As mentioned, SA Health website has got a lot of information to support you in putting a program in place. And I'd also recommend you review the other states' Healthy Workers website and the Heads Up website. I've provided the links to these below for you to be able to look at. In the next session, I'll take you through a navigation of where to get the best information on workplace wellbeing, including tools, resources, reports, case studies and support services. Thank you for watching and take care for now.